Her tongue, if you notice, her tongue is kind of moving with each breath. That's also not always happening, but it can happen. It's usually just a reflex with that end-of-life breathing. I don't know if you noticed, but she did breathe a little differently, and that is something that happens at the end of life. We almost always see people breathing in a different breathing pattern because their blood chemistry is changing because they are slowly dying, and is changing their bodies metabolically, which is causing their body to breathe different. So it's all normal, and it's just their body slowly shutting down. They do not feel like they are suffocating, which many people think that's what it looks like, or that they're like gasping for air. Those last breaths that look like gasping or like a fish out of water breathing is really a last bodily reflex. It's usually called agonal breathing. And it's not even really a true breath. It's just a reflex that happens in the body. And again, we know they're not suffering because of non-verbal cues. Most likely that person is very, very, very unconscious. So the wetness of the breath. Why do people have that wet, gurgly breath at the end of life? I've done many videos about this, but I always like to reiterate it because it's one of the biggest fears and people don't like to hear it. And people call it the death rattle because it happens right before death. People get that very wet breath. So why is it happening and what can we do about it? So it's happening because we are making saliva in our mouths unconsciously throughout the day. Our body is taking care of our mouths and they're making sure our mouths stay moist because a dry mouth is uncomfortable. So they make our mouth moist by creating saliva all throughout the day, and unconsciously, just like I did, we are swallowing that saliva. At the end of life, the body is still making that saliva to keep the mouth moist, but the brain is no longer communicating with these muscles right here to swallow it. So the person's not swallowing it. So it's just collecting in their mouth. And then, like I said, their mouth is open because of that muscle relaxation. So with every breath over that saliva, it's creating a little bit of a gurgle noise, or sometimes a lot of it of the gurgle noise. That fluid is not coming from the lungs. Your loved one is not drowning in their fluid. That is not happening. It is a little bit of saliva that's being collected in the back of the tongue. Now, the question I always get is, how do you know that's not uncomfortable for them? I think that would feel uncomfortable. Again, non-verbal cues. And if we do think it's causing them discomfort, there are things we can do. There's medications we can give to dry up those secretions. The one thing I love to do is just manually remove them, which is usually just turning the person on their side so their head is all the way turned over, and the saliva will just fall out. It'll just fall out. So that's the main thing I like to do. I don't like using the medications because a lot of times the medications will take away the secretions, but they'll also dry out the mouth, and a dry mouth isn't necessarily comfortable. So the main thing I would do is just reposition your loved one. You can always lift the head of bed up, and that can sometimes clear those secretions. You can turn them on their side, like I said, and have the secretions come out, or there's medications we can use from the hospice perspective. The hospice team can give medication to allow that saliva to dry up. Again, all very normal. It does sound bad if you're not used to hearing it, right? You're not used to your loved one sounding like that, looking like that, breathing like that. So it can feel sad and scary. Hence why this education, I think, is so important, because at least now you know why, and you know that it's normal, and you know what to expect. Still sad, still can feel scary, but hopefully a little less, so you can really be present with your loved one and know that you're doing a good job caring for them and that they are not.